Good evening, all.
Good evening, everyone.
Good evening.
Good evening, ma'am.
Good evening. Hi, everyone. Good evening. I'll wait for 2 more minutes and I'll exactly start at 8:04. Okay. So, am I audible and visible?
Yes, ma'am.
Okay. Okay. So, I'll start CBT for OCD. So, in any idea what is OCD?
An obsessive and compulsive behavior where a person has an habit or compulsion where he does a particular action in repetitive, otherwise that is an urge basically.
Okay. So, what is O and what is C?
O is obsession and it's like obsessive, and C is compulsion,
Okay.
where
Okay.
the person has a constant urge of
Hmm.
doing something, and that's compulsive. Like it hampers his regular life due to that if he won't perform it.
Okay. Yes. So basically, OCD is a type of obsessive compulsive disorder. By obsessive means a obsession for any unwanted behavior or unwanted thought. And C is the repetitive behavior which the client or which the individual is showing. For example, I'm going to talk about what are the types of OCD, but let's make it clear because uh, Vikas is not from psychological background. Ashok sir is also not from psychological background. So what exactly an individual does in OCD, apart from checking for more than 50 times, more than 100 times, there are other OCDs also like hoarding disorder, collecting or keeping newspaper which is not relevant. Like I had a client, he had an issue like he still has the newspaper, all the newspaper, not only one, from 1962 or 63. Basically, he can't show that. So I'm going to talk what exactly happens over there. So, what exactly is OCD? It's a form of disorder. It's a psychiatric disorder where a person has certain sort of obsession for unwanted behavior or unwanted thought, which leads to repetitively performing that particular thought. For example, uh, we all have heard about the form of OCD that is washing or contamination. Now, basically, what is contamination? There is a fear of germs. मेरे हाथ पे कुछ लगा नहीं है तो am I my hand is clean or what? Oh, it's something is there. I need to clean it. And that cleaning happens for more than 3 to 4 times for 5 minutes. Cleaning, coming back, again going, no, no. I feel something is there in my palm. Again coming back, again going. So it's a cycle. And it not only affects your professional life, but it deductively like it deducts your personal life also. And there are types of OCD which is a newly formed, that is pure O, which is a form of religious, sorry, not religious, relationship and sexual OCD. I'm going to talk what exactly happens over there. So am I clear? Anyone who is having DSM, can you all tell me what is the not the criteria, but what is the code of DSM for OCD? ICD? Okay. For DSM is F42. I think I have given the DSM and both DSM and ICD and Kaplan. So you all can go that, and one of the best book, if see Kaplan is a big fat book, I understand you all can't read. So more abrupt book is Fish. I have given the book of Fish also. So one of the highly recommended book on psychiatric disorder is Fish also. Now what happens in OCD? Now types of OCD. So there are mainly 6 types of OCD. Now please understand all these 6 types very clearly. Number one is contamination and washing. Now what is contamination and washing? For example, I am doing something or I am doing some household cleaning. I have washed my hand properly, but still I'm having the fear of germs in my hand. Contamination is fear of germs. Even if I'm touching my astaline or my something, this is astaline, that is my for asthma issues. Even if I'm touching this, I feel that something is there. So I need to wash my hand. And it is not only for cleaning, if I'm touching my book also, any sort of book, still I'm cleaning it. So that is what contamination and washing is. Next is symmetry. Symmetry is something which is perfectly for orderliness and in a balance. For example, mm, an individual who is organizing any sort of um, household idols, the idols which can be found everywhere. Now, the client or the individual who is having the issue of symmetry, he feels that no, this picture or this toy is little front. I need to put in an order, perfectly in a line. And with this, the client is also feeling the issue that what if the dolls or what if the idols are not in a line? That means someone is going to cause me any sort of harm. Then is checking. Now, checking is a form of OCD where the client keeps on checking with anything and everything. Lock, checking whether the meals had been done or not, opening the mails more than 3 to 4 times. Then I had a client with this Facebook issues with Facebook. The moment he gave, I'm not talking about addiction. Addiction is simply something different. He had got the diagnosis of checking by the by one of our psychiatrists. Now, what exactly happens? The moment he has given a Facebook post, he keeps on checking with the notifications whether the post is approved or not. Not the post; it's basically a reel. Now he keeps on checking with the reels that whether the reels has been done in a proper way, whether the voice is clear, whether the music is clear, blah blah blah, everything. So checking not only is restricted to locks, it can be anything. I'm checking my bag for more than 50 times before leaving for my meeting, whether everything is there or not. Even I'm opening my purse. Not only that I'm checking it per se, but I'm deeply checking it. That is what checking is. Next is hoarding disorder. People over here have issues with discarding images or discarding any sort of uh, unwanted, even unwanted, that what should be unwanted items. As I said, this client of mine, either 62 or 70, 63, he still have the newspapers. Even I had a girl, not a girl, a lady of 61, no, 59. Yeah, 59. She used to keep her hairs. The moment she used to comb the hairs, whatever hair fall she used to have, she used to gather that hair. And it has been more than 6 boxes she have gathered. So that is what with hoarding disorder. Hoarding is also a type of OCD. Next is remuneration disorder, the last one which I'm talking, but one more is also there. Remuneration disorder is a sort of issue or sort of disorder which is typically restricted with religious, with death, and everything. Now, a perfect example would be of one of our clients today itself. He was asking me, ma'am, what if I die? What is going to happen with me after I'm dying? What is the life? What is life after death? And he came to me for today, honestly I understand, but he had gone to more than 16 plus therapists to just check out the answers. And he says, I asked, what is the duration for how many years you are thinking this? He said, when I was in class 10, and he is in 45, 45 plus, but still he is not taking any medicines. Now, please don't be in a confusion that whether OCD is curable or not. OCD is never curable, but it's highly manageable. Like autism is never curable. Autism, ADHD, cerebral palsy, learning disorder, they are not curable, but they are highly manageable with the right therapeutic intervention. Next is, again, I did not write it. Definitely, I'm going to talk it over here. Next is one of the most newest form is pure O for orange. Now, what is PRO over here? Any of the individual get obsessed about relationship, obsessed about sexual orientation, obsessed about body, which is I think I gave over here. Your looks, the first one. Obsessed about one own self. I am highly obsessed about my nose. That means something. If it is happening, if I get a pimple over here, I start panicking. Along with OCD, one of the most common comorbid condition is anxiety, stress तो है ही है, panic issues, and also trauma. What if I am the last one which I was to talk about, the hypochondrosis? It's like I had a client. Now it was not my client. It was just a pro bono I was doing with my gynecologist. She had nothing. It was only a sort of big pimple, which is like a dry sort of pimple, and it was over here. And she came out with so many diseases. Ma'am, is it cancer? Is it this? Is it tumor? Whether I need to get operated? Blah blah blah. Even if you are having a shoulder pain only for 2 days, people with hypochondrosis, they might feel that it's something with spondylitis. For 2 days, if I'm not being able to sleep, definitely I would have the issue, or I would be yawning every single day. For 2 days, I'm not sleeping. But on the third day, definitely I would be having the issue of yawning. If I was on this spectrum, I would have thought I am having insomnia. Or why I'm yawning so much. The disease is this much, but for hypochondriatic individual, the disease is this much. And they are not even satisfied with the therapist. Now, this pro bono client, she went to more than 66 plus gynecologists just to listen what she wants. She did more than 10,000 like blood tests, blah blah, so many tests. She even went to do pap smear with one of a very renowned therapy, like not therapy, the clinic. What was the clinic name in Delhi? She went there. She flew from Kolkata to Delhi just for figuring out whether she was having cancer over here or not. Now, this is a sort of OCD. Now, again, a sort of OCD is trichotillomania. It's one of the greatest cause now. I have been seeing more than 20 plus cases in the month of February. That is pulling out of the hair. Now, it's not only restricted to the heads here. It can be your eyebrows. It can be your pubic hair. It can be the underarm hair also. That is what trichotillomania. Am I clear?
Ma'am, even eyelashes.
Yes, eyelashes. Wherever the hairs are there, they are trying to pulling it down. I had a friend and she was my very childhood friend. The only issue with her, she lost her mother because her mother committed suicide when we were in class 1 or 2. She had an issue with this trichotillomania, and still now she wear wigs because she did not develop her own hair. Next, one of the most OCD with childhood issues is pyromania, setting up fire. I don't know whether I give it. No, I did not give. Pyromania, but that is setting off fire. Intentionally, they are putting out fire. People says intentionally, but they are not doing it. So these are the types of disorder. Now, I would definitely like to talk about one of the most common OCD is PRO. In that, what exactly happens? The any of the individual gets so obsessed about one partner. What if my partner is living? They can't imagine. Now, what if it's like a trauma for them? The moment they start thinking about what if my partner is living, they get into panic issues. And along with that, they also have an issue with trichotillomania. What if it can be my partner is living? It can be for so many reasons, adjustment issue, communication, blah, blah, blah. But they can't imagine that. With OCD, with this sort of PRO, they can also develop an issue of deliberate self-harm, DSH. and mostly they develop. It's not that they can develop, but 70 to 80% chances are there that they will be cutting off their wrist, they will be cutting off their chest, just to prove that please don't leave me. And now one of the biggest controversial question is whether OCD is highly genetic or not genetic. Still now there has been no certain guaranteed research that yes, OCD is highly genetic. It can come over the time also. During the COVID period, most of us had the issue of contamination. Most of us. But did we develop OCD? No. But I knew of many of my clients who had developed OCD. Not even my client, my mother has also developed an issue with OCD and she is under medicines. Now, one more is checking one. The checking OCD, deliberately checking mails, deliberately checking messages. This can also come with certain sort of issues with relationship. What if my boyfriend is not texting me? Most of you can't understand Bengali, so there was a wonderful Bengali YouTube channel which came up with OCDs, particularly related with religious beliefs. I had a client, and I did not take up the client much because there were certain restrictions. This client, she was a Bengali, she got married to Muslim. Definitely she was having issue with that also, but whenever she used to sit and read Quran, whenever she was thinking that right now it's a time for me to read Quran, she was like, no, I can't. Being a Bengali girl, how I can? Definitely she was a Bengali girl, she got married and it was a love marriage. Something happened within them. Now with this, she developed not only the issue of OCD, she had multiple miscarriages. Now there are in tomorrow's class, definitely I'm going to talk about how OCD and parental health or multiple miscarriages happens. One more last thing with OCD and PRO. I still have a client. He was of a thought process that what if I'm getting married? I need to have my intimate relationship with my partner. But what if I'm hurting my partner? That is also a sort of OCD. It's not only OCD, is there is a false misconception among the therapists also. OCD has to be with us. That is with me, 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 me. But no. What if my partner, I am hurting my partner? Now again a same case, similar case. This girl used to think, what if I'm hurting my vagina only for the sake of only for the sake of having sex? Over here also, definitely how you all are going to see, how you all are going to handle this sort of sexual issues with CBT. CBT is there. You have to do exposure therapy, EPR, which I'm going to talk in the upcoming slides. Along with that, you have to do sensate focus therapy. It's a huge thing. Sensate focus therapy is not only a one day matter that you are learning everything. एक दिन में कोई सीख नहीं जाएगा sensate focus. But you have to expose the client also to sensate focus therapy. You have to know how to expose. Because the moment you are exposing in the part, in when I'm going to talk about exposure prevented therapy, there is a part which is imagination. By imagining, I'm only getting anxious. I'm not being able to proceed with my session, neither me nor my client. How you are going to handle? At the very time, mindfulness-based cognitive therapy works. Breathing exercises. Now, breathing doesn't mean only Ramdev Baba. Breathing means full body breathing. Your body breathes. Your skin breathes. Your skin over here breathes. Your hair breathes. Each and every body part have issues with breathing. You have to expose the client to breathing technique over there. And you can't tell the client that कोई भी एक YouTube video देख लो जो भी अच्छा लगे कर लो. You have to teach the process of JPMR technique. Mark my word, JPMR is not at all difficult. But people think JPMR is like, it's too difficult. JPMR is not at all difficult. You just have to know how to expose the client. Now, when I talk about OCD, do you think client who has issues with trichotillomania, the moment you are exposing the client with exposure therapy, that would work? No. Definitely CBT would work. Alongside, you have to start again with mindfulness. Why trichotillomania develops? My friend did not have any sort of, and not any sort of, matlab, she did not have any sort of other issues. The only issue was her mother. She was in class 1 or 2. I don't remember in which class we were in, but either 1 or 2, not more than that. She saw her mother burning, and that is the like cause of her trichotillomania. So you need to deep digger. And honestly, I would be pretty honest with everyone. Deeping digger doesn't mean you can learn everything from a course. We did not learn. You have to read books. Now, I'm not telling that you have to read Kaplan. Definitely, it would be pretty difficult for most of the people who are not from psychological background to read Kaplan. Kaplan, ICD, DSM, it's not a matter of joke. But you can start with Fish. Fish is an ideal book. Praveen sir, if I am having the soft copy of the book written by Praveen sir was my mentor and still he is my mentor. His books are awesome. So जो भी जानोगे disorder के बारे में, whether OCD, whether any other sexual disorder, personality disorder, it's on your process. No one is going to teach you. Why did it develop? जो भी disorders develop होगा, what is the etiology behind that? None of us knows. Now there is a thing that stress can only be developed if there is a genetic exposure. I don't have any issues with my mom, with my dad. I got more than 14 times, 14 times that whether exactly my mom, dad, or someone in my family is having or not. No one is having. I got a diagnosis of like stress disorder. I got a diagnosis of insomnia, but my mom and dad, they sleep pretty well without even taking our medicines. I do have to take 2 medicines just for the sake of sleeping. So everything is not confined with genetics, not confined with heredity. It can lead to anything. Environment, your personal experiences, anything. So there are, I have gone through today, only one of my friends said, Shraddhanjali, did you see that one of a Instagram page, they were claiming, oh, you have OCD, I'll be curing you within 5 days. I was like, really? OCD can be cured in 5 days? What? There was a big confusion. Then when I was checking the profile in Instagram, we both figured out that was a life coach. Now life coach don't know what is OCD. For them only OCD means washing the hands, checking and anything. Talk about their OCD in religious belief, they won't be able to answer. Because honestly, firstly, I was a life coach. The day when I completed my graduation, I thought that I want to be a life coach. Because in life coaching, your amount, like whatever charges you are taking, it's more than a therapy session. Then I realized I don't know what exactly are the disorders. It's pretty useless to tell people that I know everything about disorder. Still over here, until still practicing from then, doing PhD, still I can say I don't know nothing about disorder. Because disorder is a pretty vast subject. Even there are so many clinical, I'm talking about more clinical psychologists who even says that हम लोग को भी नहीं पता है. Go through the book of Kaplan. Still, I did not finish the Kaplan. I only finished up to page 237 or 230, or like not more than 300. It takes time to read disorder. It takes time to resonate in your mind that what you are going through. You need to understand when it is turning disorder. What are the criteria? You can't call yourself that, yes, I'm having a disorder. There are certain durations. Yesterday in the class, who said that for the ICD, not to yesterday's class, in this class only, someone said ICD is pretty difficult compared to DSM. Yes, it's difficult. Definitely, I agree that I agree with the part. But the thing is that you need to understand ICD more than DSM. To get a clinical diagnosis, you need to understand that, yeah, this is ICD. Even in my practice, I have my ICD. It's not only for me, for most of the therapists, but they don't say. Just because they are so-called superior. Disorder is not that hard, or disorder is not that easy. The moment you are thinking it's that easy, you that means don't know. Somewhere you don't know something. So I would request you all that I have given the book. Go through the book. एक दिन में नहीं होगा. Read for 2 3 more times. Take time. Make notes. Still, I see many of my students, in fact, graduation students, they don't make notes. जो भी the moment I'm giving them ready-made note, they are not making. Hand and eye and brain do have a coordination. The moment you are writing, you can resonate even for 0.5% also. You can remember. That's the thing my parents used to say, Jose paro. Whatever you are reading, read it from your mouth. Don't do, no. The moment you are hearing something, there is a psychological fact behind that. So I would request everyone to go through the book. Even if you are from the field of psychology, you have read psychology, please go through the book. If possible, read research papers. Ask me that, give me these books. I am more open to give you books. Take a printout. If you are comfortable in reading e-books, read it out. I have seen, like in the last class, I have suggested the dream class how to make, like how to start up there and practice. So people are going to ask, what is this? What is that? Blah, 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 blah. So read books, that would help a lot. Next is how you are going to deal with OCD clients along with CBT. Now, firstly, you have to identify the thought which is coming out. When I'm going to do, see, these are the real life cases of mine. Yes. This three, why I put up this three, pretty easier for you all to resonate. And this one was being, this two, not one, this two has been referred to me by a psychiatrist. And this age of 58 or 17, I forgot, but one was by a Niham psychiatrist, I don't remember. So when we are going to do the role play, you can understand how it happens and what exactly you have to do. So firstly, you have to identify the thought which is coming out. Leave the thought of contamination or like washing. It's pretty common. Everyone says, "हाँ मेरे को पता है, मेरे को पता है." I understand. Take a case of body issues. Obsessed with own body. I am too obsessed with my body. I can't go fat. I can't go too thin. Now you have to understand next process. You as a therapist have to write it down. You have to understand the cycle of OCD. What exactly is coming? In the last page, I have given the cycle. And it was my mistake only that in the last page. Yes. This is the cycle of OCD where you have to understand. First is a thought, an unwanted thought which is coming up. Washing hands. Chalo, take it in a very easy way. Unwanted thought, contamination, something is there in my palm, which is making me feel very anxious. I need to, not only anxious, it's also stress. Then what I'm doing? That that unwanted thought is leading to anxiety. The very moment I am feeling anxious, I'm going to wash my hand. For a very short period of time, I'm getting relaxed. Again, same thought. And it's like water cycle. It doesn't end. This is the cycle you have to make the client. You have to tell the client, this is the circle. Am I clear, Vikas? I think he is not there. Okay. Next is you have to recognize the one main fear which is associated with that. Now, fear is if I'm having germs over here after watching for 14 times or after watching for 20 times, no germs can be here, but still I'm having the fear. What if I'm taking any food, I'm eating something and the germs is going in my stomach? Now what? It is going in the stomach. The very moment you are thinking that, or the client is thinking that, you have to expose the client. You have to use the technique of exposure therapy. And along with exposure therapy, the client can feel very nervous. Because exposure therapy एक दिन में नहीं होगा. It's not a fact that एक दिन में हो जाएगा. But again and again, you have to be pretty sure that you are giving mindfulness techniques or you are calming the client down. Not only calming the client down, you have to make the client pretty comfortable. That kuch nahi hoga. OCD is well for all therapies, all psychiatric disorder. Mainly OCD and fear and phobia too. Fear and phobia mostly are same, but there is a difference. Next is how would it be working? Now, any idea how would CBT work for OCD client? How would it work? Like any particular idea, or what are the techniques you can give to the client for OCD apart from EPR or exposure therapy?
A bit of try to change the way they are thinking.
Okay, challenging the thoughts. Then, okay, you are telling that changing the thoughts, reframing, constructive
As
reformation.
in the way, yeah, the way they are thinking, from where the
Hmm.
action starts. So we try
Hmm.
to go there and try to change it.
Yes, restructuring, and you have to then challenge. Firstly, you have to challenge, then you have to restructure or reframe it. Right? Anything else? That's the moment you have to break the cycle in front of the client. As Naomi said, the first technique which you are going to use is exposure and responsive prevention therapy. Now, this is a form of behavior therapy. As I said, CBT means cognitive behavior therapy. Cognitive means everything over here. Pretty easier math is cognition is over here. Behavior is how we are acting out. Therapy is a therapy. ERP is a form of behavior therapy where again the name suggests you have to expose the client and you have to take in back the response what the client is giving you. For example, I have a fear of water, hydrophobia. Do you think in the first instant exposure therapy or response therapy would work for me?
No.
What therapy would work for me?
uh, matlab, getting speak like giving it a thought about or around the phobia, basically about water, getting them see things or feel things.
Imagery also.
Imaginary, yes. Anything else? Do you think this systematic desensitization would help? It would help, right? Yes. Gradually, you have to expose me along with systematic desensitization. So, the very first technique of exposure therapy is in vivo exposure. What is in vivo exposure? Now, please understand. Let me keep my coffee. What is in vivo exposure? As the name suggests, in vivo, where you are directly exposing the client to the stimuli. Now, water. Okay. If you are doing exposure therapy, you are exposing me. You are doing in vivo therapy, that is, you are exposing me directly to the water, and which is not very soothing for me. People having fear of snake. Do you think in vivo you can do? You as a also therapist, you can't do. What you are going to do there? Tell me.
Imagery.
Yes. Next is imaginary, as I said, or as the name says, you have to expose the client again to the images. Now I said about flashcards. Flashcards, or you have to ask the client. Definitely in the next class, I'm going to, because two of them said me that please don't start up with role play techniques. Definitely. So in the next class, when I'm going to do EPR, I'm going to talk about how you are going to expose the client. Now I remember I still have a fear of water. It was in the year 2016 when my therapist, she was a swimmer also. She said me, Shraddhanjali, chalo, swimming. No. Okay, come with me. She not said me that chalo in the swimming pool. I went with her, and the moment I saw swimming pool, I was pissed off. I started sweating badly. I was standing and I remember I was doing like this, and the full both my hand palm was pretty red because I was rubbing to the fullest. She said me, deep down or go down and come back. I said, I'm not going to do. I am not going to do because I have a fear of water. And even if it's not only a swimming pool, even during the rainy season, now the moment I'm talking, I'm getting goosebumps. Even if in the rainy seasons, if the water like it's coming up and it's gathering somewhere in my place, inside outside my house, I am too nervous. I can't go out. And it's in an instruction to everyone, please don't give me anything to do for offline because in the rainy season I don't go anywhere. And why so? It's the extreme cause of my fear. Not fear, it's a phobia. It's the extreme phobia for me. Whole for 2 or 3 months during the rainy season, I don't take up any offline walks. Even if the walk is quite like quite financially good for me too, but I won't be taking. Again, this is the cause. Now, imagination. So again, you are going to ask the client to close the eye or by the method of flashcards. There are so many flashcards you can make. You can take a printout. You can laminate. I can show you my flashcards. Like I'll be bringing from downstairs in my office. I am having. So definitely, I'm going to show you after this class itself. So that is flashcards. Now, who raised the hand? Yes, Vikas. Tell me. I think Vikas raised the hand. Yes, Vikas, tell me. Am I audible for everyone?
Yes, yes.
Yes, ma'am.
Okay, I think he raised his hand by mistake. Yes, Vikas, you are on mute. You can type it down. I think you are having your issues with your net.
Audible now?
Your net is cracking. Is it cracking only for me or for everyone? Did you hear what he said? No.
His
Okay.
voice is not clear.
Yes, Vikas, please, you can write it down in the chat box. I'm going to take up your questions. Okay. Next is responsive prevention. Now, responsive prevention is like the moment the client is being exposed to the most fearful situation, you are noting down the response. And it has to be a habit for most of us. Now, in vivo exposure, what generally we do is we go with the client. Again, we take in consideration of our phobias also. We are having a phobia of snake, and the client is also having a phobia of snake. I would request please don't take such cases because you are only getting triggered. And the moment you as a therapy is getting triggered, the client would feel that. Now, initially, I did a very dumb mistake, I would say. It was in the beginning of 2016. That was my very first case. I was too happy. I took up the case. I did not know what is the thing, and I took up it. And it was only in the very first session, the client said, ma'am, I am having issues with my water. I said, okay, you can drink water. And that was, I was too young. I took up. Then the moment he said me, I am having issue with water. I can't swim. I can't even take bath. But because that was again a sort of extreme case, I was like, "Arey, mere ko chodo," because I was getting triggered. Not only with OCD, even if you are having issue with trauma, you have went through the cases of molestation. I would request please don't take up certain cases because not only you as a therapist, but the client can read your body languages. Because there are so many YouTube videos, and even my mother, my father, not being from this background, he knows how to read my body language. If I'm saying a lie, even if I'm not lying and I'm saying something, he can understand what if I am going to do that. So अभी YouTube में बहुत सारे videos है whether when anyone can read. And in fact, in not in last year, yes, last year I don't remember the month. I got up a case. I took it. I was honestly I was having issues with my divorce, so I was pretty pissed off. I had a thinking that all boys are too bad, boys are not worth of getting married, and I was stigmatizing boys. Now, this individual who came up to me, he was also having an issue with divorce. He said me that I don't like girls, I'm not going to like get married. And I said him, please get up from my room because I can't tolerate boys. Not last year, it was in the year 2019. Yes, that the year when I had my divorce. So if you are having issues with certain things, please don't take up. There are clients, there are therapists, not clients, there are therapists who have issues with trans clients, particularly the LGBTQ clients. Kink client, please don't take it because they are going to tell you the story. And if you are doing, please don't tell, they can understand. So don't deteriorate their mental condition. Tell them I'm not supposed to take up these clients because I don't know or I don't have enough much of educations. Because telling no doesn't mean you are going you're down or you are showing down to your own self. It means you are telling the client a truth thing that I don't know this. Next, okay, one more thing in EPR is introceptive exposure. What exactly happens over there? It's like you are exposing again to the client, and it's only for the phobia. I'm not talking about this in OCD. I was supposed to talk about in phobia class, but I thought of talking it right now. It's intrusive exposure where you are exposing the client to the most triggering form of stimuli. Now, for example, my water. You are doing in vivo. That means you are telling me dip your hand in the water. It can be a cup, and the cup is full of water, filled with water. Dip the hand. Are you comfortable? This is in vivo. But if when I'm talking about interoceptive, it means again you are like exposing the way my madam did it for swimming pool. That is only for phobia, not for OCD. In vivo is only for OCD. Clear? Because there are no certain things that they have so much of phobia. OCD के लिए phobia नहीं होगा or not even fear. But yes, fear can come that what if I'm taking for contamination? What if I'm eating something and the germs is going in my stomach? Then again, hypochondrosis that if I'm having this, I would have this, I would have diarrhea, blah, blah, blah. So this is the components of EPR. Clear with that? Okay, Vikas, you wanted to say something? I think he's having some network issues. Next is deep breathing exercises. Now, deep breathing exercises are something which is not limited or yes, ma'am, then I shall okay, definitely. It's not only that you are limiting the client that only to do Ramdev Baba, inhale and exhale or hold. No. It means you are doing something which is related not only to your brain, not only to the client's brain, but to the nostril portion also. Now, there are so many breathing techniques. It can be any sort of yoga. If any one of you all are aware of any sort of yoga therapy, you can ask the client. But again, if you are not a trained yoga therapist, 1,000 hours trained yoga therapist, you can't do any sort of higher form of yoga. Savasana, sitting exercises, cat pose, they can be done. Child pose, again, they can be done. But not more than that. The very highest form of yoga, which that Sadhviks does. Cat pose, most of you know. Horse pose, most of you know. Surya Namaskar, most of you know. But not more than that. Now, when you are doing any sort of deep breathing exercises, make sure that the client is following your instruction. You can play a music, you can't play a music. Again, over here, you have to follow a method of client-centered therapy. Now, what is client-centered therapy? Client-centered therapy is a form of therapy which addresses the client needs. If you are thinking, for example, I am having an issue that I don't know. I am having issue with concentration. And I am having also an issue of communication with my mother. Now, if you all are a therapist, you know that concentration, the moment I'm going to improve my concentration, I can also improve the communication with my mother. But When you are following client centered therapy, it means you have to take my opinion. You can't tell that you have to do this or you as a therapist will be doing that. It means client centered. I am your client and it has to be my centered or my way of telling you that no, I don't need of concentration. I need to do something so that I can improve my communication with my mother. Now you have to take in the communication thing, that whether you need to play a music or not. But as a therapist, generally, please don't play any sort of jig music and religious music, because it can be you are not liking the music, the client likes the music, so then again you are there bound to be triggered. There are certain religious where we get triggered. Please avoid that. Instead of that, you can play any sort of nature music. And if you all want, I can give what links. Only two links I have, which I have saved it for my clients. I play around them only. I don't give them any answer or any poll that which one do you want, because that generally the client prefers certain sort of music which I don't like, which can again obstruct the therapy, because therapy has to be in a very calm mode. It's not like you are listening to Bacha and you are doing therapy. Over there, you can only follow, but ask the permission or take the permission that can I play a music or not? Do you like a music or not? Bus, nothing else. Yes, play. No, don't play. Over here, again, take in the option of writing it down. Now, after doing breathing exercises, ask the client either to do either to draw how the client is feeling now. That is one form, which in the activity we say is that figure your emotion. Give them certain crayons, whatever is available with you. Ask the client to figure out one certain emotion and draw something, which is a form of expressive art therapy. And if you don't want the client to draw something, ask the client to write how the client is feeling. So that, because in CBT, when you are doing CBT, you have to keep everything in handy with you so that you can track the client progress, because here the client progress matters a lot. You can also, there is one good technique for 5 4 3 2 1 technique, which is a form of grounding method. Next is box breathing technique, which is again pretty effective for this process. And it's 5 4 5 method, which is a form of deep breathing, where only the instruction is in 5 you have to inhale, 4 you have to hold, again in 5 you have to exhale, and only in between you can play a music. And it has to be repeated for 3 times. 5 4 5, a break for 2 seconds. 5 4 5, break for 2 seconds. Again 5 4 5, break for 2 seconds. This is what deep breathing exercises means. And yes, along with that, you can do PMR exercises, that is Jacobson progressive muscle relaxation. Tomorrow, definitely, I'm going to do how to do. See, this is not that I'm going to say and you can you can resonate. You have to do, and how the picture is going, it's exactly right the way you have to do. But over here, everything starts from leg, like from down portion. It's not that from here head to toe, it's from toe to head, niche se upar. And it's one of the very effective method, not only for OCD, clients having issue with anxiety, client having issue with stress issue, client having sleeping, like sleep disorder, insomnia or parasomnia issue, client who are having issues, that is sleep disorder, that is sleepwalking particularly. And also, if a client is coming up with an issue with sexual dysfunctions, JPMR can help a lot over there also. Okay. Next is cognitive restructuring. Now, what exactly is cognitive restructuring? As Naomi said, you have to challenge, definitely, you have to challenge the thought process. Now, by only challenging, you can't leave the client. You have to reframe the thought or restructure the thought with the client. Now, again, a thing is that you can't tell the client whatever I am saying, you have to listen to that. You have to ask the client that, is it okay if I ask you something, or is it okay if I'm framing the question? You can definitely give an input. Taking the client's input matters a lot. And over here, when you are using any sort of cognitive restructuring, please don't forget to use inputs of sarcastic questioning or humor. What if, for example, issues with discarding? Okay, hoarding disorder. I am having removing my class 1, 2 books. If you are doing cognitive restructuring, please make it a point of using humor also, so that I, as a client, can understand that it's not to use to keep that unused thing with me still. But again, you have to keep it also in mind that whether the thing is associated with any sort of nostalgia or not. For instance, I still have something which is not being used for most of my house member, but it is one of the most used thing. That is my small box, which my grandmother she gave me, and it was being in the year 2003 when she died. Still, I do have that. Now, for most of us, you are going to think, "Arey, a white black box. What is the use of that?" I'm not keeping anything, but it's a sort of attachment which I'm having still with my grandmother. So when you are doing any CBT, or when you are doing CBT for hoarding disorder, please keep in mind whether the thing is attached to any sort of nostalgia or not. Then don't use any power of sarcastic questioning. Because if someone says me, "Are Shraddhanjali, your grandmother died in 2003, she took a birth, or she is right now a ghost and you are still keeping something," believe me, I'm going to slap that individual. Definitely. But there is a power of cognitive restructuring also. What you are doing with that box? For me, if I'm being a client, it's my grandmother who gave me. Okay, so can you keep something in that box? No, I'm not going to give something. Again, when you are using CBT, please make sure that the client can come with a issue with rigidity. I'm not going to change my power or thought process. Now there was a Bengali video which has been viral a lot, that a renowned dancer, most of you are aware of her, Mamta Shankar. She is from Kolkata, like she is one of a renowned dancer as well as an actor. She said she is in the age of 60 or 62, somewhere below, like between that, not less than that, definitely. Now her main question was, Mamta auntie said that right now most of the girls are wearing sari, as if the girls who are standing in front of the lamp post, they are wearing. Now her version was, we most of, not only we, most of the girls are right now don't know how to wear a sari. They are either draping it in something which turns to be nothing, and they are either wearing it with top or sleeveless top or something which they found, or auntie of that age or a dignified woman would find that sari itself for Indian culture is a very traditional thing, is being associated with sari. So how they are wearing that? And auntie did not mean any bad thing, but there were so many controversies regarding that also. Now after that, I was having a word with auntie over phone. I said, "Auntie, uh, uh, you said something which people are criticizing." She said me, "I don't bother what people are saying. Barking dog seldom bite." She said me, "Barking dog seldom bite, and what is harming me? Because it is proving what is their thought process." Now, one of our clinical psychologists in Kolkata, again, she stood in front of a lamppost. She was wearing the sari where everything was being exposed, and blah blah blah. Again, a controversy was being created. So, see, as in the relationship class, also Ashok sir can relate. I said that I feel after girls are getting married, it's my opinion, we should wear sindoor, we should wear Mangal Sutra, we should wear the, like in Bengali culture, we call it a Shakha and Pola. It's for me, but I have seen most of my friends and even my sister, Sindhu to chori do, nothing is there. Even there is no some certain symbols that they are married. Now, if someone starts CBT with me, definitely I know they are not going to do any sort of cognitive restructuring, because my way of thinking can't change CBT, or CBT can't change. Definitely. Because it's not only a tradition, what I have seen, my grandmother was walking, my mom was also walking, but still I saw them wearing this. And it's Bengali culture. I have seen lot of men, not men, women who are walking, but still they're wearing. So what if they are not women? Or what if they are not modern women? So if certain people or if certain client comes up, please don't do CBT. Stop CBT. Start with expressive art therapy. Let them express. Because as a therapist, what is our main motto? To help the client to identify what is causing them any sort of problem or not. It's not that to change their thought in a 360-degree level, that you have to be very modern. Modern right now means for most of the girls, we should wear bikini. But it's not like that. Modern doesn't comes by wearing bikini or by wearing certain dress with shorts. It's something else. So when any individual who is coming too rigid matlab too rigid, please don't do matlab CBT. CBT don't go well with me, I understand, but there can be therapists who can do CBT. I don't know who can, but there can be therapists. But ask them to vent out. Because the one who are rigid, let me tell you a inner thing. The one who are rigid, for them, venting out is pretty important. Because there are so many piles up of emotions, negative emotions. I can't talk to them. Like I can't, matlab like individual who can't express themselves. The moment they are expressing, they are being criticized. So it's better not to talk or not to write anything, not to post anything. So please don't do any sort of CBT. Ask them for expressive art therapy. And if you are aware of how to conduct an expressive art therapy session or archaeology session, you can definitely start off. Next, yes. Now, the moment you have identified what are the thoughts which is coming up for OCD, which are very automatic in nature, but they are mostly unwanted. Next is, then you have to identify what sort of defense mechanism the client is using. For example, it's like if I talk about relationship, if I talk about PRO, which is mainly for relationship, what if my partner is leaving me? What if my partner is leaving me, and that is the automatic thoughts? Now, you as a therapist would have to identify what defense mechanism I or that individual who is coming up is using. Now, what you have to do, you have to ask the questions. Close-ended, open-ended, definitely by probing. Why do you think if your partner leaves you, what would happen? I'm going to die. Definitely, the moment the individual says, you can identify that it is a sort of immature defense mechanism. Again, you have to particularly figure out what sort of immature mechanism the client is doing. Now, why do you think that you are going to die? There's so many other options. No, I can't live without that person. Definitely, I can't live. Why you think so? The moment the client is saying, I can't, why you think so? Again, ask back to the client, why you think so? I can't. Why you can't? I don't know, but I can't. Now, why you can't tell me? Somewhere I feel I can't live without you. Okay, you feel you can't live without him. Why you can't live without him? Do you have any sort of proof that you can't live without him? Now, definitely what you have done, you have disputed her thought process, the client's thought process. By asking, do you have any sort of relevant proof for that? The client can't give, definitely. Now, what exactly you have to do? You have to replace the thought, the unwanted thought, with a very perfect one. You can definitely live without, but again, it would take time if your partner is leaving you. I understand you would have a high level of issues that you can't adjust with anyone. You won't be able to like adjust, blah blah blah. But you can. What is your qualification? Any qualification what the client underwent, he or she would be. You can do. You can work on your professional life. I'm not talking right now about personal thing, but professional do have some importance. So what you have done, you have disputed the thought process and you are trying to replace with that new thought. Now this fourth step is not as simple as it's given in the PPT. Definitely not. It's pretty difficult. Pretty matlab pretty ही difficult. And celebrate, if you all are having an idea of Jessica Alba, she had issues with OCD. She was a client of OCD, not mine, because she's a celebrity. You can read out her life story. It is a life story. Yeah. See how her therapist did CBT with her. It's available in YouTube, it's available in Google, but I would request to see in YouTube, not to read, because you can't understand. And there are more than 45 sessions which she took it in a time. She broke the session, maximum 25 sessions, but she gave part one, part two, part three in that way. See that video, how it is happening, how the disputation of thought happened, and then the client, or then the not the client, the therapist is replacing the thought, new thought. But please be sure that the client is not on the verge of express or accepting your thought. No, I need my professional life. Okay, you don't need your professional life. Do you think you can do something? Yes, I can do, but I don't need my professional life. What is that you can do? I'm a good dancer. I can dance. So don't you think that is dancing is a profession? Somewhat I think, but not as much as I deserve. That's the point you have to again hit. What do you think? What do you deserve? Because see, CBT is nothing. Because in criminal, not in criminal, as a criminal psychologist, most of the criminal psychologists use the power of CBT. Client एक version बोलेगा, you have to address that same version and you have to trigger the client. Then the client would come down and would express the thought, whatever the client wants to. But again, it has to be done in a very careful manner so that the client is not hurting. Because it can be of a fact the client is hurting himself or herself in front of a therapist. Now you don't know what would be exactly happening. Next is one of the most newest form, but this therapy or this technique for exposure therapy is not generally being given by a therapist. Okay, it has to be under a trained medical practitioner. Now, medical practitioner doesn't mean it's a PhD holder. It has to be someone who has undergone MBBS, a medical doctor. Now, when we are doing our PhD, we are doctorate, not a doctor. We are doctorate. There is a difference between DR, doctor, and doctorate. So this sort of therapy, which is mostly related with magnetic field in our brain. Now, if I show you this picture, yes, we all are aware of our neurons in our brain. It's not that I have to explain. So it's generally like, or this is a machine which has been given. Now I took the picture. Definitely you can see this video. How does this work? But it's like more of ECG. Every single thing has been given over here and the recording has been captured. Report has been delivered. Then as a therapist, you have to work. But again, in if I talk about my state, in my state, this magnetic stimulation is not there. Because for this, it's reading your brain. See, it's reading your brain because it's being attached with, like, there is a sort of magnet which is being over here. And one of a thing, I don't know whether in this video or not in this video, but definitely if I'm going to get the video link, I'm going to share. One of my therapists said me that this magnetic stimulation, some of the clients have reported the moment the magnet is being pushed over here, it starts vibrating and it's a sort of pain. So again, it's a very new, I won't say new, definitely I won't say new, but definitely a very painful method of delivering or of solving OCD. But please don't do it in this way because you are not a medical trained practitioner and you are not supposed to do it. But definitely what you can do is you can read the reports. And now if you know how to read the report, because there are certain numbers like heart ka ye hota hai na, it's like this. So if you know how to read the report, you can, or else ask the physician to read it, summaries out for the therapist, and then you can directly expose the client. But yes, again, be very sure when you are doing this thing with your client, not you, But when the client is being referred by you, because you have to refer, this is a jhanjat of the therapist. Now, this one I won't be playing right now. Yeah. Now, what are the models of OCD, not ACD? Number one is P. You have to be very patient. As I said, जो चारों techniques था, it sounds pretty easy, or it's pretty easily given over here, but it's not that easy. एक एक steps के लिए you need 5 to 6 sessions, or more than that, not 5, not even 5. Then please don't think, as I said, please don't think the client is accepting whatever you are saying. When you are disputing the thoughts, or when you are challenging the thoughts, or when you are reframing the thought. But again, you have to be patient, but because you have to always expect the client is not accepting. It happens. And it's not only in the word, but if you are practicing also, you can see the client is not accepting. Then is not to seek reassurance. Now over here, there is a thing which we tell that whatever the client is saying, we are like, did you say this? Did you? Okay, you meant, oh, so this is this. No, you are not going to take any sort of reassurance from the client, because for OCD client, abhi kuch to tabhi kuch to tabhi kuch, like the issues with Inzani Banerjee or Mukherjee who stabbed her daughter. So don't ask for reassurance. Now, if you are fearful also, you can be on the fact that you have to confront your feeling with the client. Now, for example, if you have fear with your own body, and a client is coming to you with the issue of I am too thin, you are too thin, and the client is also too thin. You know this is the biggest fear. What is the biggest fear of the society? And you are also treating the client in that way. But apne man mein chala, I am too thin. How I am doing that? Again, if you are too sure, you can definitely terminate the session, or you are doing the therapeutic session with the client by confronting your own fear or beliefs. Next is acceptance. Definitely, if you are not accepting the client, because not only CBT, you have to know ACT, acceptance and commitment therapy for OCD. Not only for OCD, for most of the psychiatric conditions, you have to know acceptance. Acceptance is the key to change. Without accepting, the client won't change, and without the client changing, that means you have not accepted the client as the client is. Definitely relaxation and breathing exercises, definitely. Without that, it won't help. The moment you are exposing the client, you have to start with mindfulness based cognitive therapy, MBCT. Next is, as I said, dispute old thoughts, unful thoughts, and develop a newer version of that. Disputation, definitely, because it's a main factor of OCD, not only with OCD, with CBT. You have to challenge the thought, and you have to reframe whatever the client is saying. Now, there would be a homework, definitely, but before this, yes, no. Now, there are 5 case studies. Okay. Number one, it's pretty clear over here. 1, 2, 3, 4, 5. Now, the homework is how many are 1, 2, 3, 4, 5, 6, 7, 8. Okay, 8 of you are there. You have to formulate a 25 days plan for the same case over here. For example, taking the case of Mita, now the names has been changed, ages has been same, occupation somewhere it has been changed for yes. Occupation has been changed. Definitely names has been changed. Occupation for one has been changed, but the symptoms and complaints are similar. It has not been changed. Now, Amita, age 45, occupation housewife, she came up with a complaint of excessive washing clothes, hands, etc. Now, this is the issue of contamination. OCD, contamination. As a therapist, how you are going to start the client, like take up this situation, and how you are going to start the therapeutic process, you have to write it down. Now, in the form of case study, हम लोग case study formulate करते हैं. This is what you have to do. Now, whoever would be doing what, It's up to you. I'm not going to tell that, yeah, you have to do this or you have to do that. It's up to you. Adi, what happened? Shit. You have to do. I'm not going to say who is taking what case. आप लोग के ऊपर है. Whoever feels, but it has to be 25 days plan. Minimum 25. You can move beyond that 25, but minimum 25 days plan for this particular 3-1. And this has been referred to me by a psychiatrist. Now, the second case of Simati, she was also a housewife, but I did not write. This was a case of celebrity. Yeah. Yes, this was a celebrity case. So the name, age, everything has been changed. So I'm not going to talk about the age, but the complaints are pretty similar. Only one has been left over here, which I'm not going to talk about right now because it's a case of phobia. So when I'm going to do phobia, that case has to be dealt over there also. She was having issues with OCD and phobia too. So I strike it off phobia and I gave a case of Simiti. So 25 again, a 25 days plan has to be curated. How you all are going to do, what you all are going to do, it's up to you. I'm not going to tell. Okay. Any questions till now? And this is one of a video where whatever I said today, CT, cognitive therapy, CBT, cognitive behavior therapy, and ERP, exposure preventive therapy, is given over here. So you have to see this video and you have to check all the videos and you can do it as per your need. But if anyone is asking anyone, we can understand. Me and Sachi are there to understand. So yes, Vikas, tell me what you wanted.
Ma'am, in between you asked if I've understood about the temporary happiness of washing hands. Did I understand or not? So during that time I heard, but I couldn't access my phone then. So I understood that. Next is, ma'am, while you were explaining, you told about a client being worried about germs or having OCD about
Contamination.
germs.
Yes.
Yeah, contamination. But you mentioned exposure therapy for the person having contamination thing. How do you go about the contamination thing in exposure therapy? So you'll start giving utensils with some amount of dirt, or
No, no,
what
no, no,
kind
no.
of way are you germs का हम exposure therapy कैसे करेंगे? That was one
See,
question I
it's
had.
just a OCD. Okay, is there any other questions?
Ma'am, in
No.
between you mentioned about art, but then you answered, like while going on, I understood why you told art therapy. That is about
Hmm,
venting out. I got my answer over there itself.
hmm.
And with respect to case studies, ma'am, even in the one of the assignments you told for 25 days of plan. So
Okay. Huh.
me being a beginner, I don't understand 25 days plan मतलब किस तरह? पहले दिन केस हिस्ट्री लूंगा, बात करूंगा, पता लगाऊंगा,
Okay,
फिर
so
उसके बाद
today
क्या?
I would be giving you the like I need to click. So tomorrow is a full day holiday. So today I would be giving you the like my samples if I am having. So yes, I have the samples. So just the thing is that see when you are a beginner, you can do a 10-day plan. If you are see you are not from the psychological background, only for you it's can be a 10-day plan. But for most of you, not for most, but for others, it has to be for 25 days. And those who will be watching, because without giving the exams, not the assignments, uh, practitioner certificate won't be delivered from Heal Talks. Because it's one of the most crucial thing because you are being certified not only as a CBT therapist, but as a practitioner. That means you are allowed to practice. So the moment you are getting the certificate of practitioner, you have to take certain responsibilities. So this was my report which I took during my internships. So just the thing is that I would be scanning everything. It would require time. So I would see how many. This is for the case record. Now case record are of two types. As we are not doing anything related to sexual dysfunction, sexual dysfunction के लिए अलग केस like case forma है, but this is for child child case record, and this is for adult. Now, child means starting from 5 years to 12 years. This case can be given, and ऊपर में लिखा हुआ है that this is for the child and adolescents. But please keep in mind, this is from our department, that is from psychological department of Rajabaja Science College. So you all can't like use anywhere, but definitely it is for your benefit of learning. So that, because right now I also can't use this because there are certain restrictions. You can modify accordingly because there are certain topics which you can't take it out, like which you can't ask the, not, I won't say ask the client definitely, but you being from, anyone being from non-psychological practitioner, you can't take up cases. Now, over here, this is a page of mental status examination, MESE. Now, over here, there are things which is like speech and language ability. There are options: relevant, irrelevant, coherent, incoherent, goal directed, non goal directed, poverty of content, over abundance means pressure of speech. This is only for speech and language ability. If I talk about memory, in memory, there are again three: remote memory, which is personal and impersonal; recent memory, you have to write it down; immediate memory, that is DF, DB, word recall. Now, you all don't know what is DF, what is DB, what is word recall, right? So it would be very difficult for you all to take it. If I talk about mood, you only know mood means sad and happy, or angry, which is under sad itself. But if I talk about mood, it can be of two types: subjective and objective. Subjective, you have to write a terminology which is there in our cases. Objective: euthymic, anxious, panicable, fearful, distressful, weeping, spell, irritability, enlarged, cheerful, euphoric, elated, inability, flat, burnt, doffic. So many things. Everything means similar. If I talk about anxious and if I talk about panic, in anxiety disorder, there is a symptom of panic. Whenever you are anxious, we always panic. Now, you can't tick both the things. Not only you, even I also can't tick both the things. So there has to be certain fine differences between everything. That's the reason I said when you are doing any sort of CRF, you can't exactly copy, as I said. So I'm going to give this full scaling, but whenever you are taking something, customize it. Now, as I said, for child, it is from 5 to 12. But honestly, if you see my word, I have from 5 to 10, 10 to 15, 15 to 20, 20 to 25, and more than that. And everything is different. Genetic population different. If I see clients coming from LGBT background, everything different. For lesbian client, there are different, gay different, trans different, everything different, and also non-binary, binary different. Now again, if you are taking in cases of acid attack, everything has to be different because you can't give in one single category. So definitely there are more than, I don't know, I am going to give everything to you all. It's up to you all how you all can memorize it or not. But try to customize the case format so that you can understand. And yes, definitely, as Vikas you said me, I'm going to give one of a case study which I did it during my internship. So you can understand how to formulate a case. Because it has to be in that fact that we as a therapist, we have to go to the rigorous process of internship. Like right now, people are doing online internship. हम लोग के time में no online was nothing there. In fact, we have to do a minimum amount of 1 year. Every single department. Psychiatry department, gyno department, urology department, pediatric department, all the department. And it was completely frustrating. So I'm not going to give all the cases, but I'm going to give a case of psychiatric department. Yes, and yes, definitely I'm going to give you how to take up the examination. See, it is not a exam like how to take up a therapy session course, right? So definitely you don't know how to take the therapy session. Apart from CBT, therapy session means initial 1-2 session has to be taken in which format. So there is a format for us also, not for us, matlab when we did it. So it's a Xerox material, but definitely I'll be scanning it. I'll be putting it. I'll ask Jhalak to give it in the drive. If it is not in the drive, I would request everyone, because from Canva, I'm not being able to send in WhatsApp because my WhatsApp is totally full with hell amount of messages. So if it would be better if you all are writing your mail ID in the group, so that I would be putting you all in a loop. I'll be forwarding it. It would be easier from your side also to have that materials in the your, like in your mail ID, because my WhatsApp is not working, and that is the issue with my thing, so that I'm not being able to forward anything. So I would request that you all can send your mail ID in the group. I would be adding you. And today I can't commit honestly. Ashok sir, not over here. I would forget. In the group, you can write it down in the group. But definitely by tomorrow, because tomorrow is absolutely an holiday for me. Tomorrow you are going to get all the MSc and CRF. So that is how you have to formulate a case. If you think you can't formulate a case, you can write a case study in this manner itself. So whatever suits you.
Ma'am, now as such, you will be giving an example or a go-to case study that you have already attempted in internship. What I'm
Hmm.
asking is, so that would be a reference for now.
Hmm.
So when you are going about, like some client is coming to you and you are going to formulate a plan for 10
Hmm.
days. So once the person say Mita comes, okay,
Hmm.
you come to understand what her issue is a little. Then you decide accordingly, yeah, should I go first with exposure therapy or CBT or art therapy? And you decide. There is if or and such situation, either or and maybe and as well. Then you go to day two. Then you'll try to find more about it. But are there any tools? Are there any inventories? Like, how are you planning for 25 days? When you're not sure, like I always used to think it goes with flow, like हाँ हम 2 दिन का प्लान कर सकते हैं 25 दिन का कैसे प्लान करेंगे जब तक 2 दिन का पता नहीं चला unless you know what exactly the issue of the client is. Now you know हाँ कि अभी इसको मैं पहले एविडेंस दिखाऊंगा या दिखाऊंगी 2 दिन एविडेंस दिखाओगे वो जैसे मेलो डाउन होगा तो मैं फिर उसको बोलूंगी कि देख ऐसा हो सकता है क्या लाइक आई लेट द क्लाइंट आंसर his own thoughts. So in that subjective way I can plan. Like अगर मैं वैसे सोचूं इमेजिन करने लगूं कि मैं क्लाइंट के साथ इंटरेक्शन कर रहा हूं बट आप जब 25 days प्लान बोल रहे हैं इट सीम्स लाइक ए प्रोजेक्ट लाइक इट्स इन जैसे एजेंडा होता है या एल्गोरिदम होता है हम स्टेप्स लगाते हैं वो कैसे होगा how do you go about it is what I'm trying to ask.
Okay. See, firstly, it's not that I take the whole decision that whether I'm going to do the CBT or REBT, any sort of therapy. Okay? I majorly try to customize it, because, as I said, if there are certain clients who come up that I don't want to work on, uh, take for the example of Sagar, issues with concentration, inabilities, self doubt, and worry. So, मेरे को पता है, if I'm going to work on self doubt, honestly, he can have eradicated other issues like inabilities and worry, because I am doubting myself. So, what I'm doing, I am doubting not only myself, I am getting worried, right? So, as a therapist, I know that the moment I'm working on the self doubt issue, I can work on other three issues. But what if Sagar is not uh, saying that no, I want to work only on concentration? I said my other issues, but I want to work only my on my concentration. So तब क्या हो जाता है? I am doing client centered therapy. ठीक है? That's the time I'm doing client centered, because I'm listening to the client. And there are other cases when I don't listen to the client. I am telling you both the things in which I do my session. I don't listen to my client. What I generally do is I focus on, okay, ठीक है, only self doubt. The moment I'm working on self doubt, irritabilities and worries are going to get removed. Then concentration only I would be working on. So क्या हुआ? मेरे हिसाब से दो इशू, बट क्लाइंट के हिसाब से एक इशू दैट आई वांट टू वर्क ऑन. So then for 1 and 2 days, I'm taking this whole long MSc and case record. I know what are the issues the client is presenting. Third day, I am trying to get more on the issue of why concentration. Only on studies. If studies, what are the subject? Because generally when a client comes, there is a particular subject the client is coming on, or it can be a fact that I'm not concentrating when I'm studying alone. Group study, perfect. Single study, zero. Again, what had happened for the third day, I tried to figure out, okay, these are the probabilities. And honestly, I have more worksheets. As you said, inventories, I have worksheets. I don't go with the inventory. क्योंकि क्या होता है ना, inventories are more of their person oriented. Like I have curated an inventory which would be on my like experiences. I have seen this kind, and hence I have developed an inventory which is right now very famous. So no, नहीं होगा. आप लोग के हिसाब से नहीं होगा. For me, for example, if I had to take up the case of Sagar, I am focusing on self doubt. I am doing CBT. I am doing art therapy. Okay. Then I come with rational REBT, which is rational emotive behavior therapy. And if the client is again having certain issue with body, I am going for ACT. But if I have to talk in the way Hina being a therapist, Hina says, no, I'm not going to do all this sort of therapy. I'm only going to focus whether the client is having issues of deliberate self-harm, that is issue of cutting of the wrist. What Hina is going to do, Hina is going to start up with only with DBT. Full focus DBT, and other issues are not being concerned, for example. It's not working in that way. So we as a therapist, or I being a practitioner, what I do is I have worksheets. Now worksheets in terms of, as I said, I don't use the worksheets which are available readily in like in the groups or in the materials, because there are so many organizations who provide worksheets. I try to customize it. Now how I do customize it? I have flashcards. I use the power of flashcards. The moment the issue with self-doubt comes up, that has to be accepted. If I'm not accepting the fact that I am black, what if people is criticizing me and I'm going in the phases of depression? Or I am too anxious. So what exactly is happening? I'm showing the like the client the flashcards. And I am asking the opinion from the client itself. I'm not getting any opinion. We as a therapist, we don't give any opinion. We just go for ways. This is the way, this is the way. Now you have to figure it out. But there are therapists who says, no, you have to do this. Do it for 5 long days, come back to me after 5 sessions. But that is highly professional. That means we all are professional, but that means in terms of earning money, come after 5 days or review after 5 days, because therapy session, if I talk about experience one, even if the client therapist is having experience of 5 long years, that charges would be around 1800 or 2000. Now think it. First session, first day, after 5 days, that is on 6 days, again 2000 or 1800. So it's just a way of earning money. But what I do is I go more with worksheets, or I go with art therapy, because where no therapy talks, art therapy talks much. Because see, in OCD or in any
Ma'am,
other therapy,
these are the therapies that you're talking about. I'm asking about the go-to plan that you go for. You mentioned about art therapy, you go with the worksheets, I got that. So do you plan कि हाँ day 1 में मैं केस हिस्ट्री ली, day 2 में मैं आर्ट थेरेपी करूंगी, वहां से मुझे कुछ पता चलता तो day 3 में ये करती हूँ.
I
I'm
do.
asking about how do you go about that plan?
See, on the first 1, 2, and 3 days is completely 1 and 2 days is only for case session and MSc blah 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 chala jayega. Next, on the third day, what exactly is I do is, if I think on the first and second day that the client is having issue of venting out, I make the client in form of I make the client do vent out in form of art therapy. वो मेरा थर्ड डे का प्लान हो जाएगा. ठीक है. फोर्थ डे is based on third day. What if the client is using more of colors which resonate with anger, red, black, where the client don't want to talk? Black in a white paper. This is a white paper. Everything I'm drawing black. Do you think any emotion over here can you see? No. Now fourth session would be based on third session, what I did. And honestly, I have the take quads. I don't give it to the client. Definitely, I give it to the client if the client asks, but I make it mine. But I make it a point that I'm xeroxing it from my hospital. I keep it in the folder of the clients. If offline, online maybe same hoga. Now fourth session, if I see that okay, The client is again using red color more than black, red. I'll make the client go on the therapy of play therapy. Expose कर दूंगी play therapy में. Now I see some sort of nurturing is coming up, along with issues of narcissism. Nurturing and narcissism, both are completely different, but it's coming up. I have seen, honestly, and that's the reason I'm telling you. Now, what I would be doing, fifth session is on play therapy and art therapy. Now I would be going for CBT techniques on sixth and seventh therapy. I would be talking with the client. Abhi no play therapy, no art therapy, nothing. Then homeworks would be given to the clients. Homeworks in terms of like it would depend on the client, what exactly is the client. I'm just telling what I actually do is. So जो भी homework होगा would be based on other like day 3, 4, 5 and 6. Seventh session, the client is coming back with the homework. I see homework. I find that okay, something is there in the client. I need to talk with the client. Why so? Now again, I would be challenging the thought. Give me proof. Proof nahi de paega. So what is it? The client is itself telling that no, I can't. Now again, I would be asking now what are the things you wish to work on, because almost 8 session has happened. Do you feel better? Yes, I feel better. Now what is your main issue? Only the issue is with concentration. Now what is that? I don't need 25 days for concentration, honestly. More 3 to 4 session on concentration, time management and concentration and stress management. They case post kar do. Within 12 session, the case has been wrapped up. And yes, there are clients who come back only for vent out session, that too after 2-3 months, only for 15 minutes. That is completely different. And vent out session happens only, if I talk about my area, only for housewives who are not working and for corporates. Bus and nothing else. It has been wrapped within 12 session. Max 12 session. Bus, ho gaya. Now, how did I formulate? See, I knew and I hence said. So if you are taking about a case of Sagar का ही आप case ले लो. So you think that you are going to work because CBT ka almost 6 class ho gaya. You know something about CBT. Something. I'm not saying everything. I'm talking about something. At least 20% आप भी clear ho gaya CBT. So you feel that you are going to work on worries. Now worries is again a sort of anxiety, which I said in the first and second classes, how you are going to break the cycle. Do on worries. It's a full 7-day plan. आपका हाथ में 7 day हो गया. Now you feel the time worries has been eradicated. Self-doubt and irritability has been eradicated now. You go with concentration issue. You don't even need 25 days. I said 25 only for these cases. Issue with somnia. Fear of getting aggressive in crowd. Low appetite. इसमें 25 days लग जाएगा. For Sagar case, if I do it, it would be hardly 10 days, like 10 sessions. For Mita, it would be again for 20 or 21 sessions. If I do it in my way. For Soumya, it would be again 20 sessions, not more than that. Yes. For Shruti, it would be 10 to 15 sessions, not more than 15 sessions for me. And for Rehan, 10 sessions. Bus, wrapped off. So see, I'll be very honest. CBT mein, I have seen people taking more than 3 years. CBT mein, I did cases in less than 26 sessions. Just the fact in which you are going to make a target. हम लोग बोलते हैं ना कि एक शिकारी like something of thing is there like एक ढील में 2 शिकारी और एक शिकारी में 2 ढील. That is the case which you have to do. You have to, as a therapist, you have to pinpoint that. Like in our case studies, there are cases where you have to write, yes, formulation of diagnosis. Point in favor and point in against. Over here, point in favor means what you are thinking. As a therapist, what are the points in your favor? And point in against means what the client wants to do with. The client is going on LRD, like stretching these sessions. So that is, as a therapist, the point in against for you. That's the thing. See, this is a case, or this is a MSME for us, where 98% thinks you can figure it out of a client, of a single client. Yes, obviously, if the client is not manipulating the session, if the client is not telling something lie, or if the client is not lying, definitely 98 to 97% things are cleared over here. And in it, all my students said, ma'am, in your CU, like Calcutta University, does give so much of hard MSc. Other I have of Amity University, Noida, I have of Hindu, they are having only 3 pages. So that's the depth of this records. And there are clients who don't know what exactly is bothering them. I'm feeling low, but I don't know what exactly, for what reason I'm feeling low. That also would take hardly 6 to 7 sessions, not more than 10. See, as a therapist, I'm telling, but as a beginner, if you are asking about all these cases, I did not know how to handle. I would have performed client centered only. Now, what would your be main mission? That yes, you are obviously doing client centered, but you are customizing it. There are therapists who write, I am a CBT practitioner. They don't know what is REBT, what is DBT, how to perform DBT. But there are therapists who write, I am trauma informed CBT practitioner. They only know how to do trauma alongside with CBT. Trauma and CBT goes well. But there are again therapists who write electric therapist. That means they know most of the therapy and they can go anyway. For if I talk about CBT, it can be Hina walking with excessive fear. That means OCD, sorry, not OCD, CBT. Whereas I don't know CBT, I am only doing art therapy. Which can again, by art therapy, I can find certain issues with harming, why the client is having the fear of harming ourselves. So it depends on the client. Yes, Naomi. You're on mute.
Yeah, so in these cases, in case we reach to the seventh, sixth or fifth session, so is it that we have to keep hypothetical responses or something that we think he might respond that way, and then we go ahead with the session?
See, you can keep a hypothetical. हो सकता है, नहीं भी हो सकता है. Now for me, for in this case, I remember for the case of Mita, I thought that okay, housewife to hai, maximum 15 cases I am going to cut it off. I planned it accordingly, but nahi hua. Honestly, nahi hua. And hence I gave it in a small form. Because you have to refer it to the therapist, psychiatrist. You have to refer it to the psychiatrist. पता नहीं psychiatrist like for 2 month का medicines देगा या 1 month का. If the client, if the psychiatrist is giving medicine for 1 month, client would come to you after 1 month. So क्या हुआ? The session which you made, that after 20 days, it has been like completed. It's not there. So you can go for hypothetical. You can write original cases, but I would prefer if you are writing hypothetical cases so that you all know. Because there are cases where you don't know how to formulate a case, or you have formulated a case and it's not going accordingly. So how you are going to change? You don't know because you have formulated. So it's better you all can write a hypothetical case, not an issue.
And also, ma'am, from these five, we have to do any one case?
Yes, anyone. There are 5 cases I give. Now these 2 cases have been referred by a psychiatrist. I don't remember the medicines what he gave. Only one psychiatrist he referred me, and this last case was from Demands, Rehan Wala case. This was an outside case, not from Kolkata. So why I wrote referred by a psychiatrist? Because you can understand medicines are there, and hence you have to formulate the case in that. Where
So it
medicines
is
are
post
there,
the medicines or with the medicines?
whatever suits you.
Okay.
What if the client is taking medicines and coming to you? What if the client has completed the course of medicine and he is right now coming to you? Anything.
Okay, so we can pick it up according to.
Yes, yes, yes. Customize. Yes, Sailana. Yeah, I'm
My question was saying that we have to do one out of the five, no? Only one.
so sorry. I'm question. But before doing, where is the CBT one? Not this one. Everyone.
Ma'am, your voice is not there. Can't hear you.
Okay. Is it visible right now? Or am I audible? Okay. So before writing the model, so before writing or planning the case study, I would request everyone to go to the last video. See this video, because the moment you all have received the PPT, the moment you all are going to click, it's a audible click, so you can listen. The reality is that the most is the audible treatment for OCD is exposure with response prevention, also known as behavioral therapy, CBT. Was really OCD and so I would request you all to see this video, then formulate a case study on this any one. Whatever so am I audible right now? Okay. So in the video,
Ma'am, I think you have network issue because once you're coming back again, your voice is going.
okay, Jia, I am going to send the link of we're going to it's, you all can see it because like Am I audible? Am I audible right now? Echo. Okay, okay. Is it still echoing?
No, not now.
Okay, 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 okay. So, yes, I would be giving the link of the videos so that you all can watch. And yes, definitely, whatever scene you all are taking up, just click the picture. And when you all are submitting any assignment, whether from CBT or from Dream Therapy, the subheading, like the title would be uh, okay. The title would be day one assignment, day two and three assignment for both, for CBT and SFB or REB, sorry, CBT and Dream Therapy, so that me and Sachi can understand that yes, this is for this particular day. And for this assignment, whatever assignment you all are taking up, just click the picture, and while submitting, either you all can write it down in the assignment in PDF format, in Word format, whatever, or you can click the picture and attach the same in the link and you all can submit. So the deadline for the assignments, as I said, I forgot. The deadline for the assignment I forgot, but somewhere after the class, you all have more 5 to 6 days for giving the assignments. So meanwhile, by tomorrow, max by tomorrow, I'm going to upload the CRF, yes, CRF and MSME for the format for taking the case. And meanwhile, please submit the from the mail ID so that it would be easier on my part also to mail you all the format, and you all can take a printout. You all can work on that. Okay. So yes, I'll see you all on Friday. Yes, on Friday with exposure therapy again, because exposure, you need to understand what are the forms of exposure and why exposure, number one. And on day that would be exposure on day 7. Day 8 would be OCD, sorry, CBT and phobia, how you are going to treat phobic patients who are coming. Ninth class would be mindfulness, because you need to know about JPMR technique and other sort of mindfulness. And last, that is 10th, would be a case, not a case. Yes, I think on Friday we have Monday and Wednesday, or Monday, Friday.
Monday and Wednesday. Monday and Wednesday.
Monday and Wednesday. Okay, on next Monday we are going to have, because I got confused. Because on Friday there is Dream, I think. Yes, on Friday Dream is there,
Yes,
so don't
yes.
worry. Yes, REBT is on Friday again. Okay. So, and final assessment would be on day 20. So, whatever doubts you all are having regarding to day 1 to 9, write it down, come up with the doubt clearing session would be a little longer, like 1.5 hours. If you all feel no questions are there, it would be for 1 hour only, but 1.5 hours generally. And yes, so it's all from my part. So just write down your mail ID, and by tomorrow max, I would be sending every materials like the CRF, and requesting everyone to read the books. Like start reading. Yes, Ajay ma'am.
Yes, ma'am. So I just wanted to know,
Hmm.
the assignments we can submit it in one PDF or one whatever file at the end, or it is in parts we have to submit it.
Whatever suits you.
Okay.
Whatever suits you. If you are submitting in part day 1, day 2, day 3, just in the subheading, right? The Dream Therapy, CBT day 1, CBT day 2. Or if
Okay.
you are submitting Dream Therapy, right? Dream Therapy CBT day 1, Dream Therapy day 2 in this way. And if you are giving it in a part, then also write in the subheading CBT day 1 to 9
Okay.
assignments in one PDF. We can get it.
Fine. Okay. Okay. Thank you.
Okay. So I'll see you off on Monday. So yes, feel free to ask any questions in the group. I would be there. Sachi is already there. So yes, thank you so much, everyone, and good night. Okay, good
Good night.
night. Take care.
Thank you.
Thank you.
Thank you, ma'am.
Thank you.